Raleigh County Covert Response Team of collected officials and health officials here for Warren. And what we're here today to give a little bit of information about what's happening in our community and our state. And we have the experts here that's going to be giving the correct information out and where to reach it, how to reach it. And it's just a little bit about helping the folks. We want to thank the ones, KWRF, to do live, and the others is putting it on Facebook. And what we're trying to do is just get the information out correct and where to go, what to do, and we'll be giving these intermittently as the information comes available. And now I'm gonna let the ones that are here on the panel to come and give their introduction.
Thank you for joining us this afternoon. I'm Denisa Pennington, the Mayor of Warren.
Thank you, everyone. I'm Mayor Tanya Kendricks with the City of Hermitage.
I'm Mayor Keith Hudson with the City of Banks. State Representative Jeff Wordlaw, and good afternoon. I'm gonna go ahead and introduce our doctors, and then I'll come up after they get through speaking. But Dr. Weaver, if you would, go ahead and give us a medical update.
Hello, my name is Dr. Michelle Weaver, and I'm our local county health officer. And I'm here with a friend, and also she's very knowledgeable medically to help get this information out also to Hispanic people in our community. I called this together along with Miss Alicia because we want to keep everyone in our county well informed about what's going on with the coronavirus or COVID-19. And we also want to be able to answer questions for you to decrease fear and to increase communication. Jennifer.
Les habla Jennifer por parte de la doctora Michelle Weaver. La razón de esta junta es para darles información acerca de lo que está pasando en el mundo y especialmente aquí en el condado de Bradley, en nuestro estado de Arkansas, y mantenerlos informados. Alguna pregunta que ustedes tengan, podremos informarles, les podemos responder.
Okay, so first I wanted to give some information about the coronavirus itself. The coronavirus is actually a virus that's been around for a long time. It's not a new virus in general. The coronavirus or COVID-19 is new. We've actually had 3 new coronaviruses since the year 2000.
Lo que ella quiere decir, ¿verdad? El virus del coronavirus no es un virus que sea nuevo, se ha estado con nosotros desde hace mucho tiempo, pero el que tenemos ahorita, el 19, se ha descubierto más reciente.
The majority of coronaviruses are typically going to present like a common cold. The other 2 coronaviruses we had were SARS and MERS, and this one, of course, is COVID-19. The problem that we've had with this virus, the concern, has to be with the way the virus affects people with immunocompromised states and the elderly. COVID-19 has symptoms that include cough, fever, and other upper respiratory symptoms. This time of the year, we also have people that are experiencing these symptoms just because of regular colds, flu, and other causes, even allergies.
Algunos síntomas que tiene este virus, y queremos que lo sepan, ¿verdad? Si tienen algo de tos, fiebre, si sienten como que no pueden respirar, o algún tipo de problema en sus bronquios, son los síntomas que deben de considerar para el coronavirus. Otras cosas de lo que también está la influenza, así es que a veces no sabemos si tenemos simplemente la influenza o es el coronavirus. cuando estamos no estamos seguros si tenemos uno o el otro, podemos llamar a nuestra oficina de doctores y decirles, tengo estos síntomas, puedo ir a la oficina, me pueden hacer la prueba del coronavirus, la influenza, no nada más se queden en la casa tomando remedios caseros. Es bien importante que llamen a su doctor o llamen al hospital local o algún amigo que conozcan o alguien, esto será que pueda ser el coronavirus o es alguna otra cosa. Es mejor llamar a su doctor o al servicio del hospital en emergencia.
The coronavirus is highly contagious and spreads by droplets. Droplets precautions are typically taken in a hospital setting. When something spreads by droplets, this means that it can be obtained by inhaling the virus in the air or by touching something where droplets have fallen and then by touching your mouth or face.
¿Cómo se contagia este virus? Bueno, si alguien tose, los droplets están en el aire, o si alguien también agarra su boca, tose y la contaminación puede ser en alguna superficie, es como es el contagio. Es fácil de contagiarse, por eso hay que cubrir la boca si es que va a toser, lavarse las manos regularmente, desinfectar los lugares, no tocar manos, estar separado de las personas lo más que se pueda para evitar contagios.
Currently, we were recently found out about 3 more presumptive positives in the state of Arkansas. Currently, we have 9 presumptive positives in the state of Arkansas. Presumptive positive means that the patient has tested positive within the labs in Arkansas, and their confirmation is being awaited by the CDC or Centers of Disease Control.
Hasta ahorita tenemos otros casos presentables de que se ha dado positivo para este coronavirus aquí en el estado de Arkansas, y claro, más pruebas se tendrán que hacer con el departamento de CDC, que es el departamento de enfermedades y control.
We currently do not have any positives in Bradley County.
Hasta ahorita, gracias, no hemos tenido ningún caso que se haya reportado positivo aquí en el condado de Bradley County.
Currently, the best way to not to treat the coronavirus is to not get the coronavirus.
Hasta ahorita la mejor forma de tratar este virus, coronavirus, es no infectarse con ese virus.
And this would be by prevention, and currently the recommendations are social distance, which would include not hugging or shaking hands with people. We want you to wash your hands, as you've seen on the news. Don't touch your face.
Las medidas de precauciones que debemos de tomar son no tocar manos de alguien más, no saludar de mano, no abrazarse o estar lo más alejado de las personas, cualquier contacto con otras personas, seguir lavando las manos lo más que se pueda, y tomar todas las precauciones que uno tomaría para cualquier otro virus. No tocar su cara. Si lo haces, por favor, lava tus manos inmediatamente y seguir todas las indicaciones que sean necesarias.
Yes, if you are sick, do not go to work. If you're sick, do not attend church.
Si siente que está enfermo, algún síntoma, por favor no vaya a trabajar, no mande a sus niños a la escuela, no vaya a la iglesia, o no vaya a ningún evento social. Manténgase en casa.
Most importantly, if you're sick, contact your doctor.
Y si siente algún síntoma o piensa que está enfermo, por favor llame a su doctor inmediatamente. En horas de oficina, si su doctor está cerrado, por favor llame a Bradley County Medical Center. Ellos abren todos los días, ellos siempre tienen alguien con quien uno puede hablar.
Currently, our local doctors would prefer, if you're sick, to contact their office first.
Los doctores locales, claro, ellos siempre prefieren de que uno les llame primero, si tiene alguna pregunta o si está enfermo. Inclusive algunos tienen horas de que cuando no están ahí, aún así uno puede hablar con alguien.
Yeah, they will screen you over the phone, preferably to showing up in the office. They would like for you to call, and they will screen, and then they will go from there if whether you need to come to their office or further testing is indicated.
Y si llama, ¿verdad? Y si dice creo que tengo algún síntoma del coronavirus, ellos le darán indicaciones de si es necesario que usted acuda a su oficina, o ellos le guiarán a cuál es la mejor forma para que a usted se le pueda hacer una prueba del coronavirus.
The coronavirus currently has a mortality rate of about 2%. The people that are highest risk, as I discussed earlier, are the people who are immunocompromised, and those would be people who take medications that suppress their immune systems, people that have cancer, people with diabetes, heart conditions. People with those conditions need to be aware right now of what's going on in the community.
El riesgo de mortalidad es de 2%, y las personas en riesgo son las personas de la tercera edad, o las personas que tienen un sistema inmune débil, personas que a lo mejor están pasando por algún tipo de tratamiento de cáncer o alguna otra enfermedad que pueda poner su salud en riesgo. Esas son las personas más susceptibles y en riesgo más alto.
The other high-risk group would be people who are elderly, and the local physicians have asked that if you are over 70 or have any of the other mentioned conditions, to please wait on your well visits at this time.
Como dije, las personas de la tercera edad, las personas ya más adultas, son las que están en riesgo más alto de obtener este virus. Así es que si usted ha tenido una cita o piensa agarrar una cita para ir a ver a su doctor en estos próximos días, simplemente una visita de rutina, no está enfermo, cancélela, espere cuando esto ya haya pasado. No es urgente que vaya al doctor ahorita, a menos de que lo necesite. Y si está pensando, bueno, puedo esperar, no puedo esperar, si está en duda, llame antes de acudir a su cita.
Okay. So, we'll give it next to Miss Alicia. She'll give you more information. Overall, this is just a time to prepare and not to panic. The majority of people that will even get this virus may not even know. They may have nothing but a cold. But we're doing all this in preparation to take care of those who are at most risk.
Una cosa más, este es un tiempo no para ponernos en pánico, sino para prepararnos, informarnos, estemos preparados, sigamos todas las recomendaciones que se nos ha dado. Hay mucha información aquí en nuestro condado, hay muchos recursos. Si tienen alguna pregunta, pueden llamar a la oficina de su doctor, al hospital. Cualquier persona les puede ayudar, inclusive a nosotros. Gracias.
Good afternoon. My name is Alicia Outlaw. I'm a registered nurse with the Bradley County Health Department. I want to thank Dr. Weaver for the information she shared. My purpose here today is to inform you that your best resource, written resource, is to go to www.healthy.arkansas.gov. It has all the information you should know, need to know, and want to know about the coronavirus. It's very easy to access. If you have a phone, you just Google, the address. The first page you will see is a big red block. It says COVID-19. Click on that, and it'll take you to the information. Most of the information is in black and white, but if it's royal blue with a line underneath it, you can click on that and it takes you to further information, like the CDC website. I want to highlight that the best course of action right now is prevention, and that prevention is good hygiene in the form of wonderful hand washing, soap and water. Lather up for 20 seconds. You can sing Row, Row, Row Your Boat, or any kind of little nursery song that lasts about 20 seconds. Rinse. Once you rinse, towel dry, paper towel preferably, when you're in a public bathroom. Use that towel to turn off the water and open up the doorknob to leave the building. Then toss the paper towel away. Also, if you're not able to get to soap and water, use good hand sanitizer. That definition is on the label with 70% alcohol in it. So just use that. Rub the sanitizer in first to your fingertips and then move on down into your hand. Crevices on up to your top of your hand, up to about right here of your arm. That is all I've got right now. Thank you.
Good afternoon. My name is Mahogany. I'm a registered nurse, and I'm the Warren School District nurse. I'm here in representation of our superintendent, Mr. Brian Cornish, who is staying abreast of all the concerns and issues that have to do with the Warren School District. I'm here just to speak on some of the things that we are doing in our district to help with the kids in education and preventing the spread of the coronavirus and the flu as well. For the last 3 weeks, we have incorporated in the classrooms for the teachers and the students to wipe the desk down with antibacterial wipes before and after class, as well as when they go to lunch, encourage them to wash their hands with soap and water. But if they're not able to, the hand sanitizer is available in the cafeteria. They took the opportunity today, since it's raining and kids will not be outside, to educate them during their lunch periods on, not touching, not doing the kissing, not holding the hands, and, things of that sort, and making sure that they wash their hands as often as possible, especially when after lunch, even when they go to the bathroom. Some of the other things that they're doing in the cafeteria are that they have went to wrap utensils. They've closed down the salad bars in the middle school and high school. They're going to all styrofoam plates and cups and stuff like that, so everything can be readily disposable, as well as even on the buses. Before each route and after each route, all the seats in the buses are sanitized. Every seat is hit on those buses to help combat the spread of these germs. As well as another thing that we're doing, they're disinfecting the schools daily, as well as on the weekend. We have purchased the electric static sprayer, which sprays out a fine mist with a antibacterial agent that they go through and spray every office, every classroom in the building to help combat this disease. As well as if you have any information that we release, it'll be released on the Warren School District website. We sent out letters on yesterday, as well as AMI packets, and they will release letters to you guys as soon as they're available for school shutdowns. And another thing that has come up, they're wondering why we haven't closed the school district. As of right now, since this is a emergency health problem, we do not hold jurisdiction or authority to close the school. That decision comes down from the Arkansas Department of Health and the Arkansas Department of Education, as well as the CDC. So when they issue that announcement, then that's when we have the opportunity to close our schools. And if we do close our schools, meal programs will be made available to the kids. We have a designated location, which would be the middle school, which the lunches will be able to picked up or either be dropped off. But when we come to that, then more information will be released on that as well. We just want our kids to be educated in lieu of hoping that they will be able to go out and educate their parents and younger citizens as well. But if you have any questions, please direct all that to the Warren Superintendent Office. Thank you.
I'm Suzanne Gross with the Hermitage School District Registered Nurse. We at the Hermitage School District have went around to all the classrooms and retaught proper hand washing techniques, the importance of how often to wash your hands, respiratory hygiene, keeping social distance, and avoidance of touching the face, eyes, nose, and mouth. We are screening for signs and symptoms and encouraging sick students and staff to stay at home. We went around and sanitized the buses and disinfected classrooms and doorknobs, and we make this a routine habit. We're spraying the buildings and bags, and we're keeping communication up with the parents on our social media page. Thank you.
So now that we've heard from our professionals in our school, I just want to reiterate to all of our folks that this is not a need for panic, but this is a need for caution. And we want to be very careful with our vulnerable population. And you ask yourself, what is that population? That is our elderly. So if we have people that we need to visit in a nursing home or in a human development center, we need to be discouraged not to visit those people during this time. And we need to only visit them under high need times. And you'll find when you go to the nursing home, they're going to have checkpoints. They check your temperature and a check sheet for symptoms. And we want to be sure we fill those out as truthful as possible, and we heed to all these warnings. So let's wash our hands, and let's be good stewards to our public. And thank you for listening and watching today.
We just wanted to make sure we're going to give the website again in Spanish. It's healthy.arkansas.gov.
Hay un sitio en el web que tiene mucha información acerca de esto y ustedes lo pueden buscar en su teléfono, en su computadora. Es www.healthy. healthyarkansas.com. Gov, I'm sorry. www.healthyarkansas.com. Y ellos tienen mucha información acerca de lo que ahorita se ha hablado aquí. Es bueno que lo visiten, lean, para estar más informados y no estar en pánico. Gracias.
Again, we'd like to just let everyone know that we are here for you as a united team, and that's why we put this together today, to ease tensions, ease fears, and to increase knowledge. As days go on, we're likely going to be doing this again. If you have questions, you can ask them through our Facebook page, and we'll be happy to answer those. We have, like we said, we have people from our local government. We're so happy to have our local officials here. People from our school district. I work with the health department along with Miss Alicia. She does most of the work. I'm just a caring soul that cares about our community, and I really want us all to remain healthy during this time, and that way we can decrease as much sickness as possible. If we have any questions, again, please get on our Facebook page, follow us. They're likely going to have more live videos, and I'll turn it over to Miss Denisa.
Talk about out-of-state avoiding travel.
Oh, travel. Well, they have made some restrictions to travel. I don't think what I've learned from travel restrictions is mostly not to travel to endemic areas. And so one of our cases we had here, from what I've been told, was from New Orleans. You can check the website to see the endemic areas. We definitely don't want to travel to other, like Italy, Iran, these countries, of course, China, South Korea. We want to stay out of those endemic areas. And so right now, Bradley County we don't have any positives. As soon as we get a positive, we will come back live and let the people of Bradley County know.
Just in closing for Bradley County, I just want the folks to know that we have a great team here that are united to taking care of Bradley County and the surrounding areas, and that's the main thing we want to let the folks know, that we're here, we're dedicated, and we're going to do what we have to do to serve the people of Bradley County, and we have a great team, and I want to thank you for watching. As other information comes available, we'll be passing it on through the other sources, media, social media, and we want to thank you for this. Thank you.